Hello friends, today I will talk about fever. This is the second lecture of fever. So let's start. Now we will come to another problem when there is continuous fever for more than 3 days. There are no chills but fever is continuously reducing only temporarily for few hours with paracetamol or nimesulide. This is the situation when has doctors so concerned. You may feel that 3 days is too short a period to think of prolonged fever like typhoid is true, very true, but is generally practiced. If fever does not reduce within 3 days before you can antibiotic on the 4th days, the patient will have change in his doctor. I do not mean to say change antibiotic frequently or investigationally, but this is you tracted full. You should keep the patient and relative confidence so them you are concerned and assure them that you will do all the need full investigation or referral to a physician if that unnecessary, and if you feel that patient is not keep full faith in you or is over anxious for other fevers, then refer to physician before he suggested. Even when the patient has full faith you, the always 10 people around him who will advise him go to a specialist through. It is not at all necessary. It is very important that you should recognize these psychological pressure and refer the patient of physician in time. Before the patient started doubt you, it is take the one has to learn to be a successfully general practice. So with these facts in mind, if there is continuous fever for 4 to 5 days, you should the investigation of particular hemoglobin, WBC's platelets count and peripheral smear or malarial parasite, vital test and urine examination. Examine the patient clinically, very thoroughly, look for pallor, jaundice, palpate the liver, spleen, lymph nodes, auscultate the chest examination, the joints, leg edema, throat congestion. The antibiotic choice would be a quinolone, ofloxacin, ciprofloxacin, or if the fever is very high, so second or third generation cephalosporin, which will cover most fever including incarnate typhoid fever. Now we will come to the importance of associated symptom is cause of fever. First is headache. If the patient of fever complain headache, you should always test for neck stiffness. With the patient lying down, examination table, flex the neck or touch to the chin and sternum. Neck stiffness indicates meningitis. There are other more common causes for headache like malaria fever, but the earlier causes of meningitis which you may see 1 to 3 years can only be auscultated for if you have a relaxed habit of testing neck stiffness in every case fever with headache. If there is a neck stiffness, refer the patient immediately to a physician for lumbar punctures and CSF examination. If you give antibiotic and wait, it is the patient that you are committing if you blunder, because waste of time and delay in starting the correct antibiotic in meningitis can cause of lot of brain damage and the patient for life. Another place when you has suspect meningitis, if the patient with fever, drowsy, restless or behave abnormally. Any change the level of unconscious drowsiness or abnormal behavior with fever should make you suspect meningitis or severely. Patient is restless is bad. Trouncing around in restless the bed and talking to behave abnormally, meningitis, neck stiffness, test for all such. Patients should be referred to a physician early. When a patient with high grade fever suddenly become unconscious or drowsy, there are three conditions which you should suspect: meningitis, encephalitis and cerebral malaria. When hep2 lumbar puncture and CFS study rapidly malaria test for P. P. falciparum peripheral smear for MP. In addition to be route of infection in any cause such as a patient to be treated by a physician and not to GP. If a patient of low grade fever or minimally fever so altered consciousness alter or behave, then it is a most likely be a case of TB and meningitis. So if the patient comes with high fever and altered behavior, test for neck stiffness. If there is a neck stiffness, refer to physician immediately. If there is no neck stiffness, give injection of paracetamol, tab paracetamol 650 mg and high antibiotics. After the fever come down, if the behavior become normal, then continue treatment under your care. But if the patient behave abnormal even after become afebrile, then refer the patient. The third associated symptom could be cough. It is the patient fever has associated cough. The bronchitis and pharyngitis are common cause, but is the fever is high, patient to look like toxic, dyspnea and tachycardia, then you should think pneumonia and ask the X-ray of chest and blood count. If fever is cough are not severe but they did not respond cause of antibiotic for a week, then also you should ask for the chest X-ray to rule out of tuberculosis. Next associated symptom should be joint pain. If a child or young patient with fever has joint pain, look for tachycardia, chest pain or murmur. Think of rheumatic fever. Start penicillin on consult the pediatrician. If an adult patient complains of fever with joints pain, think of chikungunya, started NSAID combination and stronger analgesic. If the fever is associated with splenomegaly, first think of malaria and second typhoid, and rarely you make a cross leukemia. Blood test we will make diagnosed with clear, but if all blood tests are normal, then treated fever is splenomegaly as a case of malaria. Similarly is to the fever associated with hepatomegaly. First look for jaundice of infective hepatitis. Secondly, think of typhoid fever. In both conditions, liver is soft and slightly tender. If fever is not fever is not tender, you must rule out leukemia and ask for ultrasonography to rule out primary and secondary malignancy in their liver. Lastly, you will come to a patient who has fever continuously or on and off for a long period, say you month or so, especially if the fever on and off. If seriousness on long duration of are not realized, as the patient continues to work in between episodes of fever, such long dawn fever need to be a investigation full detail hemoglobin, WBC, peripheral smear, ESR, blood sugar, blood urea in serum, creatinine, that vital test, Brucella test, TB, IgM and IgG test, for HIV test, X-ray of the chest, ultrasonography of abdomen. These are some of the basic investigation tests or vital. X-ray chest may need to be repeated as necessary. If the fever is no response to treatment, the prolonged fever usually have some underlying journals disease like tuberculosis or severe anemia, leukemia, lymphoma. So there must be careful, investigally followed up, refer to a physician. Thank you very much.